Welcome to the Stress Free Dentist Podcast. I'm your host, Dr. Eric Block. As always, I want to inspire, entertain, and educate you on the best tools and technologies out there. My goal is to help make your practice and career more profitable, efficient, and most importantly, more enjoyable. And check out all of my nonfiction and children's books on Amazon, and check out the stressfreedentist.com for any upcoming events. And if you're feeling you're a dental professional that's burnt out, or you just feel stuck or want to get to that next level, visit the International Academy of Dental Life Coaches or www.iadlc.com, and we'll get you matched up with a life coach that understands dentistry. I also wanted to thank our amazing sponsor, Equa Marketing. They have helped me and my practice over the years to improve with SEO and website performance. And to find out how you can make your practice dominate in your area, go to www.equa.com/MSMSFD to book your complimentary meeting. Again, that's www.ekwa.com/MSMSFD. All right, everyone, welcome back to another episode. And today we are joined by Nancy Kagan, who is the managing partner at Rosen Summit Dental Advisors. Nancy, thanks so much for joining us.
Oh, it's my pleasure. Thanks for having me.
Yeah, we met over at Yankee Dental not too long ago, and I'm glad we got to meet. I want to hear all about your book and all about what you do over at Rosen Summit Dental Advisors and helping dentists and their practices. But first, just give me an origin story of how you even got into dentistry.
Okay. Hygiene school right out of high school. Kind of liked the sciences, so it just kind of drove me there. Went to Forsyth, graduated at it was a long time ago. And, very different time in dentistry. And I practiced for about 4 years. And through a series of circumstances, I thought there was a bit of a void. So I started a company called Dental Temporaries. And I did staffing for dental offices for many years. And at the end of that period in my life, I got involved in managing. So I managed over the course of a 25-ish year career of 2 large practices. So really kind of cut my teeth on all things practice management. And when the second office there was a professional divorce there, and it was really not going to be a practice at the end of that, I decided to dip my toe into going out on my own. And I thought I'd be maybe a temporary manager in different offices, help over here and then move on. And didn't really have the plan that I ended up with. But so I was on my own for about 7 years. And then I brought on my first consultant to work with me. And here we are now 20 some odd years later with 3 consultants on the road and a billing division that we've had for about 10 years. So we do billing for dental offices. So there are about 40 people in that division that just, that are doing that service. So I am now running the company, not really on the road per se. I do a lot of virtual consulting, but not really on the road.
And you mentioned billing. What are some of the ways that you're really getting in there and helping these practices?
So fascinating to me that the billing started because we had some of our consulting clients who couldn't quite keep up with the insurance claims and the submission of the claims and the managing the claims and the posting of the checks. And it started out there. But what really has been, to me, the biggest takeaway is the fact that there is somebody outside of your payroll whose interests aligned with yours, which is we only get paid if we collect. So our interests are aligned. And it is fascinating, not maybe in the best way, at how poorly money is handled and how much loss there is, how much, we all know that, we're in an environment where there is a lot of embezzlement, how the balance of power is so off that our docs don't know. And we have to work hard to convince them that things are happening because it's hard to believe. So that part of it, and I always tell new clients when they call that you get the typical services that a lot of people offer for sure, right? We post your checks, we send your claims, but because of our consulting background, I think, we don't we take the blinders off and we're going to tell you what we see. and we're going to tell you whether you like it or not. And if there's fraud going on, we're going to tell you. We're not the police, but we are going to tell you that. And we are very picky about our clients, because if things are going on that are risky, we're not going to be a party to that. So there's so much of that shocked me, I guess, so I would say that's the big takeaway.
When you start with a practice, how does it work? Do you start with basically like an audit, and you check out all their billing and their books and make sure everything's up to snuff, and then go from there?
Well, we would love to do that. I mean, that's really kind of the focus of what I do, virtually. Most of the time someone is calling us, it's usually a staffing issue, right? I've had people, they quit, or something's off with my money, my production's high, but I don't have any money in the bank. There's a pain point, right? And so we try to log in if they'll let us. We try to get in there and just even get a baseline of what they, people say, yeah, I don't think my problem is with my claims. I think it's with my patient balances. And we go in and go, no, the problem is with the claims. Lots of patient credits, lots of things that just aren't right. So we like to get in there, but sometimes it's best to start, build some trust. And then, 30 days later, we say, listen, we're seeing some things where we think you should know. Would you be okay if we did a deeper dive and we spent a little bit more time and we tried to educate you about what we see? So sometimes it really works that we build the trust first and then they let us dive in.
How often are you finding some level of fraud or embezzlement?
Often.
Mm-hmm.
But sometimes it's intentional and sometimes it's through just, ignorance. Someone doesn't know. But what we see a lot is allocation issues, right? So if the money isn't allocated properly, you might be paying an associate incorrectly, less or more. We do a tremendous amount of projects where we are going in and reallocating money because we just had one recently, an endodontist didn't think that her pay was right. She just didn't think that she was getting paid for her services. We went back 6 years and we had to look at who got the payments, who were they really supposed to go to, and how do we kind of shake that out? Is she owed money or not? So allocation, honestly, is the biggest issue because it's harder to allocate than not. So oftentimes the people that are doing it, it's easier to put a payment in and let the software move it than it is to say, okay, who saw the patient? How much went for the exam to the doc? How much went to the hygienist? And so we see a lot of that. We do see, fraud, and we do see, I could talk a lot about that because we've had some really almost fascinating stories about the ways that people have done that and how we've been able to figure it out. But I suppose a client who comes to us recognizes something's off. We may not be seeing the nice, clean ones because they're probably not coming and looking for the service. You know what I mean? But when I do my virtual audits, when I log into the software and I do an audit of the reporting, that's often. I mean, yesterday we had a new client coming on board, $196,000 in patient credits. Doesn't know what that is. Doesn't have any idea. So what's happening is they're not accurate, but when the patients are coming in, they're telling the patient, you don't have to make a copayment today because you have a credit on your account, but they don't have a credit. So
does this get increasingly more complicated as you start seeing practices with more and more PPO involvement and insurance involvement, and get less complicated as offices reduce their insurance dependence and go out of network?
Yes, less complicated, but I think the roadblock, or the reason it gets complicated, is because of the lack of knowledge with the person who's responsible for the task, right? I mean, if I mean, again, I could give you a lot of examples, but what happens is some software, some people put fee schedules in, right? They're in network with 5 insurances. They think the fee schedules are in there correctly, but they're not. So what happens is the ledger may read that the service was $80, but the payment is $92. So now there's a credit on that account, but if someone doesn't realize that happened, the patient now has a $12 credit that they can use, but they never paid anything. Mm-hmm. Right. So it's a lot of it is just operator error, lack of knowledge, and the pushback is shocking to me. Like when we try to point it out to someone, they'll say, no, yes, right. And here's the evidence of it. So problematic. And as we get involved with practice transitions, I mean, these credits become a big deal.
Yeah.
Right. So.
And now on the consulting side, what are you seeing? What's a common thread for practices that are really successful?
I might say it's a practice owner who recognizes what they know and don't know and compensates for that, right? So it's a practice owner that's paying attention, that's educating themselves about what is healthy and what isn't healthy. I think that dentistry is a people business, and I think all the bells and whistles are really important. But if you don't have the skill and you can't bring patients to yes, and if you don't even know if they're coming there, right? Sometimes people think, because a patient shakes their head in the hygiene chair, that means they're going to go out and make the appointment, right? And keep the appointment. So I think the practices that are successful really are, willing to be a little introspective and where are my strengths? And, am I willing to ask? There's an enormous amount of fear, especially with the staffing concerns about challenging an employee, an administrative employee, asking for accountability. I mean, I think everybody should know every day what % of the patients from the day before that needed treatment said yes. Right. I don't think that should be a mystery. I think, I always say this, you want to know, you don't want to guess. So successful practice probably have owners that aren't afraid to know. They don't, I think, I don't want to hear, I'm pretty sure, I think I don't think that's a problem because she's been with me for a long time and she's really good. I want to know your numbers. I want you to back it up with something that gives you the confidence that it's real. So I think people that do that really are the ones that are most successul.
The data don't lie, right? So
I say numbers don't lie. I know sometimes, but numbers for the most part don't lie.
And
I always say if I you can get up in the morning and put on something and say, well, my pants feel a little big today, and then you got to step on the scale and go, oh, yeah, okay. That's the truth, right?
Yeah, we actually, we just recently looked at our treatment plan acceptance numbers, and I wasn't totally happy with it. We had a lower percentage than I was hoping. And, we went fully out of network last year, and we no longer can compensate this lower treatment plan acceptance rate with the volume of patients that we used to had as when we were in network with insurance. So it's just so important to know these numbers and, not to criticize, but to figure out how to improve, right? If your numbers aren't there, figure out how to improve them.
Well, right. I always say it's a team sport. So if your numbers aren't there, that's the result of something, right? So now you have to be willing to go back to the beginning and really kind of like open it up and say, okay, what do we say to our patients? Do we tell our patients, it's so subtle in dentistry, at least it feels like it to me. If you say to a patient, did you want to schedule that crown? And they say not right now. Now you've got this reactive list of people that didn't say yes. What you really want to do is create, kind of that sense of urgency to the patient. Like, listen, the doctor really wants me to get you in as soon as possible. It's a different conversation. So I think you have to have a team that understands that conversation takes place everywhere. What does the hygienist say when you leave the room? When the patient says, do I really need to do that? Do they say, you can wait till next year, right? Do we know what's being said? Are we really willing to look at that as a team and say, where does that process break that we didn't get that patient to yes? Especially as providers and, doctors' offices that have associates, you need to know that, right? You need to really understand. And if I always say confidence sells. And if you give a patient the option, say, you might want to think about, doing something, that's probably all they're going to do is think about it. So I think we look to our providers to give us, confident diagnoses, and I think we get a better result from that. So hats off for would be a willingness to look at that and try to figure out why that is.
Yeah, and there's several touch points where
Yeah.
the patient could, start to question whether they need to move forward, and it's in the hygiene room, the doctor's room, and then handing off to the front desk. So
Right.
at each one of those touch points, everyone's got to be well versed and with the same on the same page and the same verbiage, correct?
Right, 100%. And, it's so interesting that everything goes, you look at the front desk and, a provider will come out and say, did they schedule, or how come they didn't schedule? Or, it doesn't begin and end there, right? It's, the front desk is only as good as the education the patient received at the chair. And the patient that, you can't schedule a patient that doesn't believe they have a problem to solve, right? You have to have, they have to be educated that they have a problem. And then the administrative team has to help them solve the problem by, working through the money or working through the schedule. So I think it's very easy to kind of hold the front desk responsible for the schedule, but it's everybody. It's that whole process. And sometimes the staff at the front will say things to us like, this is happening back there, so I can't get them in the schedule, but they don't want to, they don't want to out or call somebody out that they're not doing their piece of it. It's, again, we call it like the circle, and you just want to make sure nothing breaks that. Where does the circle breaking, right?
Well, what's a great way to hand that off? Let's say we had a great, consultation, whether it's in the dentist chair or the hygiene chair. We showed the patient, x-rays, videos, models, risks and benefits, and told them, if you don't take care of this could happen. What's the best handoff to continue that momentum to the front desk to get that patient to, to schedule and get them in the hands of the front desk to make it happen?
So I have two comments. One is I really believe this. I said people don't care what you know until they know that you care. So the care piece has to be in equal measure to the knowledge piece. So that's first of all. And second of all, that sense of urgency should carry through. That handoff to me from the chair to the front desk at the end of treatment is critical. And I have a lot of scripting in the book, but we talk about saying to the the person that's walking the patient out, to say to someone at the front desk, to be able to say, what's the soonest appointment, in Dr. Block's schedule, because he's really concerned about number 15, right? That the urgency continues, right? And if the patient says to the front desk, what is it? What do I need? Then you know that something broke down in the back. And I always say, I would go back to the provider and say, the patient seems unclear, right? Doesn't mean you didn't do a great job of explaining it. It just means that the patient did not absorb it in a way that made them feel that sense of urgency. So, but I think it's about that handoff, and that there should be what's the first appointment in the doctor's book? Because we got to do this ASAP. We're really worried that if this doesn't happen, there's going to be a bigger problem, right? So, and I also think that if a patient is making a recall and there's something going on, it's good to say, I'm going to make a note in your appointment. We tell this to hygienists. I'm going to make a note in your appointment about that upper right, so that we can address that first thing when you come back, so that there is a connection to keeping that appointment. Because, right, instead of it just being, did you want to make your recall, or did you want to, right? So it's all about really that sense of urgency.
Love it. What you said there is, some great verbiage and very, very simple to say. You mentioned the book. Tell me about your book and why did you write it, and what was that journey like?
Okay, so always been interested in education for the administrative team, because every other position in the office has an education route. Assistants can go to assisting school, hygienists, doctors, but the administrative team didn't really have that. So I actually opened up a brick and mortar at one time, and I had a partner, wonderful partner, And we wanted to register with the state as an educational school. We didn't want to take any chances. At that time they were closing some schools. So that process took a really long time, and sadly it didn't afford us the opportunity to keep going. But a lot of this material came from there. What is the school? What do we want people to learn? What can we teach them? So it was very ground floor, very comprehensive, from all things from scripting and how to talk to patients, and what all the way through all the processes that should be in place at the front desk. Excuse me. So that's where it started. We were approached by Worcester State. They wanted to do a class, a non-credit class in dental administration. So we honed the content a little bit further, and then COVID hit. And so obviously everything stopped. I'm sorry. And I would say it's never been off my mind that I have this content. And what am I going to do with this content? So last year, I decided to look through the content again. I realized it needed some updating. It was 4 or 5 years later. So I hired an editor, and I, fine-tuned the content, and she made it worthy. And it's full of pictures, it's full of scripting. It's just very comprehensive. And my intention was that it would not only be a resource for the existing team, but people might be able to now, people call us all the time. My sister's going to start helping out at the front desk. Where should she go to learn? So this is what I thought it would be a resource like that.
And what's the name of the book?
It is Dental Administration, or Beginner's Reference.
And where can we find it?
It's an ebook for sale on our website, rsdentaladvisors.com.
All right. And now we also chatted about you got into buyer rep. Can you tell me exactly what that means?
Yes. Again, along the same lines of education, we wanted to make sure that when someone was buying their first practice, that they not only got the stats from the broker, but that we actually took them in and went through the software. We really felt that we needed to make sure we were not brokers. We were not going to tell them, buy this, don't buy this. We were going to tell them what they were buying, right? So because it was really hard when new owners would get in and they didn't realize that there was no time of service collection. They couldn't pay their bills. And they were trying to re-educate a staff who was giving them resistance because they were new and the dynamics were off. And it just seemed like, how can we get these buyers more ready when they walk in the door? So my partner, Blake Cohen, really spearheaded the buyer rep product that we have today, where he does cash flow analysis. He goes into the office or virtually and goes through all the software with the buyer, educates them so that they're aware of what they're buying, what they need to know. And then we follow through with some support once they're in the practice. There's a lot of nuances that go into that, not only with the staff, but also with the software and making sure everything is transitioned right, making sure the credentialing, we do credentialing now for that reason, so that we can make sure that's being handled correctly, because it almost never is. So we do all of that, and we like to think that we're just, we're like if you really shouldn't buy a house without a home inspection. Well, we're like the practice inspection, and we feel, and it's huge. I mean, we're really busy in that space, because I think people recognize that it's kind of the first step in their education as a practice owner.
Now, did we miss anything? What are any other services that you offer your dental clients?
So our consulting model hasn't changed really in all these years. We want every practice to have a really good foundation to support growth. That's really good systems that are written, that are measurable and that are managed by a well-trained team. So we don't want people to be your systems. We don't want someone to say, oh, Mary does that and it's great. And then they call when Mary is out on an unexpected medical and nobody knows what to do. We do SOPs, and we have manuals that we create specifically for the practice. So that's the foundation of consulting. We're right there in the practice with the staff, with the docs, really trying to make sure that they're running well operationally. So that's the consulting side. The billing side, I think we talked about. We do a lot of projects on the billing side, cleanups. Like we said, we're reallocating sometimes. We do a lot of that. We do credentialing in tandem with our buyer rep. We want to make sure that process is done well, because it has been really challenging to have offices transitions happen when that's not done and no money comes in and there's no backdating and people aren't ready. So we like to control that and help our buyers as well on the credentialing side. So those are the, kind of the core things that we offer our clients.
All right. 2 final questions. How do we find out more about what you're up to? And my favorite question, what advice would you give to the young dentists out there?
Oh boy. How much time do I have? No, just kidding. Well, they can reach us. The website is really comprehensive. I think it gives people what they need. It's again, rsdentaladvisors.com. We have some, social media as well through the website that you can see us on Facebook and Instagram. We do a lot of speaking. We try to really put ourselves out there. We're big on education and educating. So my partner Blake does a lot of speaking. We try to support local, in Massachusetts, the local chapters, if you will, of the MDS. We speak for the MDS. So I feel like we're a little bit of everywhere, but the website is really probably the central place to find that out. My contact information is there, of course. So advice, don't be afraid, right? That's my advice. I can't encourage young dentists enough to ask the questions you need to ask. Right? To educate yourself about how a practice runs. Dentists buy businesses they don't know anything about, right? They can produce the product, but they have no idea how to get paid for that product. They don't understand it. They don't know. Dentists don't know what insurances they're in network with. They don't know the fee schedules for those insurances. Not across the board. I don't want to paint everyone with the same brush, but I wouldn't have been doing practice management successfully for the many years if they did. So I think make sure you know and you're not guessing, even as an associate. We've been involved with many associates where we've had to help them figure out, have they been paid properly? How do they get paid? What does the report look like? What does it mean? I mean, if you have adjustments in the wrong column in some software, it can add or subtract from your compensation. So really be educated. Don't be afraid to ask, and knowing, not guessing.
That's great stuff. Nancy Kagan, thank you so much for joining us. Great episode.
My pleasure. Thank you so much.
Thanks again for listening to the Stress-Free Dentist podcast. And don't hesitate to get in touch with me at info@thestressfreedentist.com. And if you haven't already, please subscribe on your favorite platform and leave us a review. Until the next episode, I'm Dr. Eric Block, the Stress-Free Dentist.